I had undiagnosed ADHD, and then my anxiety, which I didn't know that's what it was at the time, was getting worse and worse. I couldn't handle it anymore.
High school was kind of a rough time for me because that's when I really started struggling with my mental health. My parents had just gotten divorced. I struggled through high school and college with an eating disorder, so I kind of felt untethered and a little bit unmoored. And
I was diagnosed with Tourette's at 10 and depression when I was 18. I was feeling suicidal every day, and eventually this led to a suicide attempt, and I landed in the hospital.
A lot of things in my life, like I've been slashed in the face, alcoholism since a young age, just like I have my ups and downs.
Mental health looks very different for everyone, and so it's a person-centered approach to getting the help that you need at your point of need.
I went through a period of maybe like 5 years where I just couldn't stay out of the hospital. I was like constantly in crisis. I was in the emergency room like every couple of weeks, and that's when I called Paul Lovejoy, the director of PROS at Jawonio.
PROS stands for Personalized Recovery Oriented Services. It's a group-based program that helps individuals with mental health challenges to set goals that will help improve their own lives and their functioning.
We can do art therapy, music therapy. We have groups that are more clinically based, coping skills, basic living skills, meditation, yoga, mindfulness.
They come to us and we work with them to achieve their primary goal.
The goals can be, I want to live independently, or I want to get a job or volunteer. I want to make friends. I want to start a relationship with somebody. I immediately fell in love with PROS and the philosophy behind it. We weren't there to focus on somebody's issues and problems or symptoms. We were there to help raise them up and focus on the strengths and resiliency within each person.
I've had a lot to work through, and after many years of pain, it takes a long time to also get over that pain. They've been very supportive and understanding of my struggles.
Even at a number that have actually graduated from PROS, where they got a full-time job, their own apartment, a vehicle, just acquired what they desired. PROS works.
Now I work for an organization called NIAPRS, which stands for New York Association of Psychiatric Rehabilitation Services. So I do outreach and I help people. I don't think I would be where I am today if I didn't have Jawonio.
It's an organization that uses the diverse interests and life experience of its staff to be able to help the diverse interests and life experience of its participants.
I was adopted. Even though I was raised in a really wonderful, loving environment, there was still that question about who am I? I did a search for my birth mother when I was 18 years old, and my birth mother did not want to meet me, and she did not want to move forward with the process. And so I required the support of a social worker during that time. I just so valued what they did for me, even if it was just like holding my hand while I cried. And that's when I realized that this is what I want to kind of give back to other people, the way that I was helped by them.
Recently, we received 2 very significant awards that are going to change the game for our mental health services. We received a federal award for construction. The other significant award we received was the New York State Healthcare Transformation Grant to help pay for a new space for a new home for our mental health program.
It's going to allow us to build a modern state-of-the-art facility, and it's going to allow us to bring our community back together in one location with staff and participants all in the same place.
They've been operating out of different temporary space here on our main campus. For them to be able to put down roots and really own the space that they're in, it's going to be invaluable for them.
Jawonio just provides so many services for so many individuals in Rockland.
The CORE program is a new program in New York State which offers the same types of services that the PROS programs offers, but we meet individuals in the community.
Transitions started in 2017, so it was really kind of started as more hospital diversion. I had an NYPD police officer who had experienced a trauma and needed to come into transitions short term while she was on medical leave. And during that time, she found out that her grandmother was dying. So she was sitting at her grandmother's deathbed and then hopping onto Zoom to be with her supports. My client said, I don't know if I could have done this without you guys being here with me.
The Front Porch is a social and recreational program that provides an opportunity for a person with mental health challenges really just to come to a place and socialize.
In care management, what we're there for is to make sure people are connected to primary care services, to all the specialists that one may need in order to be successful.
They had counselors for you, they had advisors for you. Carrie as a counselor has been great. She's easy to talk to. I can call her anytime. If I need something, Carrie's right there. It's just step by step. They hold your hand basically and walk you through a path of what's right.
From where I saw William, he had just gotten out of the hospital, and to see him where he is now, in the community, sober, and identifying, that he had, some mental health problems along with that, his depression, and he was able to treat that, and now he's like independent, living in the community, and so it's so great to see.
From clothes on my back to dental work, what's being done. Got my apartment, living stable, sober still, following my treatment plans, keeping up with my goals. If Jawonio wasn't back in my life, I'd probably be back on the street.
If Jawonio Mental Health Services did not exist, I believe that there would be a lot of people who felt lost by their mental illness and not able to see their own potential, and that you can survive and thrive even with mental illness. A lot of our participants don't have safe environments, and so Jawonio becomes one of them.
Our goal at Jawonio is to destigmatize mental illness and the notion that it's embarrassing or shameful to be able to live your life with a mental health disability.
This is a place at Jawonio where people really care and people get it and people are really human and nobody is judging anybody else.
Definitely don't be afraid. Come in, have an open mind, open heart. They're gonna welcome you regardless, like no matter what your disability is or anything.
Jawonio offers hope. Jawonio offers freedom and independence, and it certainly is a place where no matter what your abilities are, you can live a full life.
Thank you to Jawonio and to PROS and to all the staff for believing in me and believing in all my peers when I couldn't believe in myself, and for others when they weren't able to believe in themselves.